So what's this IV Margarita thing? I get asked a lot. So the relaxing medicine that's typically used to go from the pre-op area to the operating room is midazolam, which is typically used in America for a lot of anesthesia cases, especially adults. We typically have an IV, so it's easy to administer. It is something that helps you relax all that hypervigilance that you might have. Just the anticipatory anxiety going into any kind of anesthesia or surgery, which is very normal. It helps kind of quell that and calm that down. And many times you also find that you don't really remember too much after receiving that. If you receive it in the pre-op area before rolling to the operating room around that time, you may not even remember going to the operating room and may not even remember having the monitors placed in the operating room. I can't tell you how many times I've had patients swear up and down that they were asleep already before they got to the operating room, and people have come in for a different surgery and I've taken care of. I know that they were talking to me the first time and they feel like they never were awake whenever they went in the first time when they come through the second time. So it's just the nature of the medication. It helps relax you. As far as major memory problems down the road, there's not a lot of evidence that shows a lot of that is going on. In fact, I would say it is extremely rare to find that someone has a problem with the relaxing medicine that can make you forget just temporarily for that time frame of the surgery. The medication that keeps you fully asleep, the general anesthesia, is actually another medication. So it's the relaxing medicine is just a bridge to help you get to the operating room and not feel so nervous and just calm your nervous system down, which actually helps us in the long run too. And the receptors that it affects, one of the receptors is similar to the receptor that alcohol affects. So someone might ask you if you're really sensitive to alcohol or something of that nature. If you're accustomed to drinking a lot of alcohol or using a medication called a benzodiazepine, which is the family of that medication, such as Xanax is one of the longer acting ones that people use in the general public that's prescribed by a physician at times. Those, if you're used to those things, sometimes your tolerance, you have more of a tolerance for it. So it may not affect you as profoundly as someone who's not used to seeing that medication. So any other questions about that, feel free to ask your anesthesia provider.